Hey guys, it's Ireland, and today is my 2-week post-op update from having double jaw surgery. Just getting used to talking. This is my profiles. I really hope this swelling goes down soon of this side of my face, but I don't know how long it'll be. My surgery was on February 9th and it is February 23rd today. So I just wanted to show you guys my essentials, the things that I really felt like I needed for this surgery so that you guys could get those things too. So when you get out of the hospital, they'll send you home with some syringes with catheters on them. And this is how you're supposed to pretty much eat and drink everything. And these suck. They literally, like, this one's broken. I would not recommend relying on these. The only thing that I do use this for is when I brush my teeth, because I can brush my teeth now. I use this to just rinse out my mouth because it's kind of hard to like open your mouth that wide. Basically what I would suggest getting, what I saw a lot of people get, is these they're like, it's kind of like a ketchup bottle. I found these at Target. They're just in the kitchen section. I think they're around $4 and I got 2 of them. I would recommend maybe getting 3 of them because one for water, one for sweet stuff, one for savory stuff. But these have helped a lot because you can just squeeze it into your mouth, which is a lot better than the syringe because then you have to keep filling up the syringe. It's annoying. But with that, the opening is pretty small, and when you're making smoothies and shakes, you definitely are going to want one of these if you don't already have it because it helps you get it in there so much easier. You'll just thank me later because you'll be really annoyed if you don't have this. I already have this, so I don't know where to get one, but I bet you can get one anywhere. It's just a little funnel. Also, if you don't have a blender, you have one that's shitty, I would definitely recommend investing in one because if you think you're going to go into the surgery without one, you're not going to be able to. It is a liquid diet and it sucks, so a blender is definitely a necessity. The other thing is I would definitely ask your surgeon like what they're gonna give you because I was gonna buy one of these but then they told me they're giving me it. It's called a jaw bra, like literally that's what it's called. And they give you ice packs to put in here too, and then it just goes around your face as you've seen in pictures and videos before. So if they aren't going to give you this, which I feel like they will because you're going to need it like directly after your surgery, but yeah, this is a big necessity. The other thing is after surgery, your face is like so big and your lips are super chapped and you like can't even feel them. If you've watched my previous videos, you saw how crazy my face looked. Vaseline is a necessity because you really want to keep that area hydrated. You don't want it to dry out. It's really important. My lips are pretty much back to normal now, but there's still irritation like around my mouth just because it was such an intense surgery. My mouth was open for so long. So I've been putting vitamin E oil around that area because that just is going to help that heal back to normal. For pain, they'll give you painkillers, but you're going to want an ibuprofen as well. For me, my mom got me a liquid ibuprofen and I literally couldn't, like, it stung so bad when I drank it. So I was lucky because I wasn't like shut. I know that other people are sometimes shut right after their surgery. But I think like a couple days after, maybe around like day 5 or something, I was able to take pills, which if I like crushing up pills just sucks because you can taste it and it's disgusting. So anyways, you're gonna want other forms of pain medication, which they'll tell you because you can't take that much, like oxys. And then also with this, I got Tylenol because you don't want to take too much ibuprofen. Right now, 2 weeks post-op, I only really have like this kind of weird pain around my face. It kind of just feels like achy, and I have pain in my left ear that just won't really go away. Sometimes I still like to put ice on my face because it just like feels good, but also I like to put heat, and you can always do like a hot washcloth, but that just gets cold really quick. This is like an eye mask thing, and you can put it in the microwave, and it really helps for like that ear pain or just pain around your jaw, because sometimes with the cold it feels good to have heat on after you have cold on. So I would recommend, if you have something like this, it might be helpful for you if you are having that pain after. This definitely has helped my ear pain a lot. The other thing I want to talk about is tissues. I did not think I was going to need tissues for some reason, but I literally went through 2 tissue boxes in like 2 days, I think, because right after my surgery, your nose is like full of blood. You can't blow your nose. I still am not allowed to blow my nose. But right after that surgery, you're gonna have so much phlegm in your throat, and you're gonna be coughing it up, and it sucks. But that's the only way to get it out, and you're gonna need tissues for that. And also, I really needed tissues for, like, still to this day, my nose will just like run a little bit. Don't underestimate buying tissues, because I've gone through like 3-4 boxes, and yeah, I definitely don't need them anymore as much, but those first couple of days it was really important for me. Now for dental care, the first like week I probably didn't do anything, like, because you'll see in pics like you look crazy, you can't get in your mouth, so that's pretty gross, but I really wasn't eating anything. I am brushing my teeth every day and night now. They do give you a mouthwash. When you can't brush your teeth, they'll tell you to do saltwater rinses. I just use the syringe with some salt water and would rinse. This also will help like stitches come out over time of your mouth if you're just rinsing your mouth. I was going to buy like a baby toothbrush because I know that I wouldn't be able to get into my mouth that well, but my orthodontist gave me like a kid toothbrush, so it is a little bit smaller, but I would recommend getting smaller than this, because even now it's hard to get this in my mouth, like in the inside of my teeth. I can do it, but it kind of hurts, so I would recommend getting a smaller toothbrush if you can, because it's just going to help with your dental hygiene. The mouthwash they give you definitely helps keep your mouth clean. And then also at my orthodontist, they give me these things, so I asked for them. So this is really good for like hard to reach places, because it's really important to try to keep your teeth as clean as possible. I feel like that covers pretty much everything besides like food needs, which I don't really think I'll get into, because it's kind of like you figure that out as you go. You know that you can only eat liquid, so you kind of just gotta figure it out. The other thing that I would maybe recommend to people is that I saw a lot of these videos and people bought like these pillows that were kind of like a triangle shape, that would keep you elevated when you're sleeping. The first like week probably I was sleeping like very sitting up, like probably like this on the couch, because it was just like way more propped up, and I just felt it was more comfy on the couch. But then when I started to sleep in my bed and I could sleep a little bit more down, it was really hard to find a good pillow combination that would like keep me upright and be comfortable. Like literally my mom and I would be in my room for like 15 minutes like grabbing all the different pillows in our house, trying to make them work and be comfortable and prop me up. So I would say if you like just don't want to worry about that, because it kind of is annoying to get one of those pillows, because you do need to be propped up. For like entertainment wise, the first couple like days, I don't even remember them, because it was just so miserable is all I remember. So I wouldn't worry about like bringing something to the hospital. I wouldn't worry about like getting a bunch of things to keep you busy, whatever, because you're gonna be really out of it those first couple of days. And then After that, it was just like TV was the only thing I could do, and I'm okay with that. I've been rewatching Vampire Diaries because I'm obsessed with it. Yeah, I've pretty much just watched so much TV the last 2 weeks. Now I am slowly but surely trying to just get my life, my routine back. I luckily don't have to go to work for a month and a half more. I just really wanted to be 100% comfortable before I go back to work, so I feel like in that time, like, I'll be 100% ready, but I really just want to give myself that time. Especially because when I go to the surgeon's office in a couple days, they're gonna put rubber bands on my teeth, so I really won't be able to talk well at all, and at my work, I work retail, so I need to be able to talk. So basically, I'm just trying to get a walk in every day so I can build that strength back, and then hopefully just get into some at-home workouts, just building that strength back and trying to eat as much as possible, even though that has been the most challenging thing for me. Eating liquids literally sucks. That's the worst part of this whole thing. You really have to be patient with yourself and your body and realize that it's gonna be a while till you can eat again, till you can talk again, till you can look right again. Like, even filming this, it's like weird to see myself. The more I talk, the more normal I feel like I sound, but I still like have that lisp and I'm swollen, and no, I just look weird. I know it's a process, and 2 weeks after, it's crazy to see what I looked like even like a week ago to where I look now. You truly do get better every single day. Your swelling goes down every single day. You get more energy every single day, which is really a blessing. With that being said, I can't really think of any other necessities, and I am super happy to answer any questions. So if you guys have any questions, like, please ask them. I am probably not gonna film every day anymore because it's kind of more like not as drastic changes every day, but I'll probably just start doing like 3-week, 4-week, 5-week updates so you guys can just see how the process is and everything like that. Thank you guys for watching this crazy journey. It's honestly like very vulnerable to put this out just because the way I look, the way I'm talking, the way I went through this stuff is kind of scary to share with the world, but I really wanted to do this. I knew I wanted to do this like a year ago because these videos really helped me out. I probably watched every single jaw surgery video on YouTube so I could just learn, and I think connecting with others that have gone through it really just shows that you can go through it too, and that you will get through it. And it's still, I'm only 2 weeks post-op, feeling so much better, and I just can't wait to see what will happen 3 weeks and 4 weeks and 5 weeks and a month. And I'm so excited to eat real food. I don't know when that'll be, but I'll keep you guys updated. Let me know if there's any type of videos you guys want to see from me, and yeah.